So eyelid surgeries are one of the more common procedures that I perform. And here you can see some of the various changes that can be addressed, some excess skin or sagging skin, wrinkles and creases, even some fatty deposits under the eyes. And since we do look at each other in the eyes, as I mentioned before when we talk, it's really the most powerful area. And often when people are considering various options, various procedures, I will kind of guide them towards addressing eyelids because it really can make the most dramatic changes, as I think you'll see. An upper eyelid blepharoplasty procedure is probably one of the most gratifying and most dramatic procedures that I can perform. Here you can see a woman who beforehand, she really had trouble seeing. She appeared kind of tired and all of a sudden much more well rested. The only thing I did to this woman is I removed the extra skin above the eyelid. So right in here you can see, and in many of these patients you'll notice before surgery they didn't have anywhere to put eyeshadow.
But she doesn't have a scar line either.
Nope. This procedure, I challenge you to find a single one of the scars or incisions on these patients. Because I hide the incision in the crease that we all have, when we open up our eyes, there's a crease where the skin folds. I hide it right in that incision, and that's the most important part of this procedure. And afterwards, you can't even find it. But here's a woman who was quite excited because all of a sudden she could start putting some eyeshadow on, which she hadn't done in years. Again, this is one of the most pleasant women you'll ever meet, and yet looking at her, you might think she was quite angry. After surgery, she looks so much more like she feels, and other people now recognize just how great she looks. I'd say probably 90% of the time when people have these procedures, their friends, their family members don't really know that they had anything done. They just know that they look fantastic. So a really big difference in this woman as well. And to sort of share with you, and I'm sure that she wouldn't mind me saying, this is actually our very own Jessica's mom. My own staff trusting both me, and I really take that as probably one of the biggest points of pride, but not just with their own faces, but with their family. So I think you can all see the benefit of an upper eyelid procedure in the right patient, and again, the incisions are invisible. Switching now to the lower eyelids. The lower eyelids are a little bit different because there are a lot of different options and a lot of different techniques that can be used. I showed you before an example of the gentleman who had some filler under the eyes, and that took care of his problem really well. Well, this was someone who, if I put filler under his eyes, they'd just look more puffy. So in his case, I addressed this with the surgery, and in his it was done through a technique that really has an invisible incision because I remove the fat pockets from the inside of the eye. So here it really shows well if you look at the changes that he has, and his was really just on this one side. You can see that all of a sudden there's no puffiness. He looks much more happy and upbeat compared to before. Another example of that same technique, a woman with sort of under eye bags. That's what a lot of people come and complain about. And here afterwards, a nice smooth appearance. I did also do a similar technique to the upper eyelids, as you can see, to open up the eyes both above and below.
So I wanted to ask a question about the bags.
That's a great question. So the question was, what makes the bags? Is it blood? Why is it dark? And why does it sometimes look blue? And the answer to that is all of the above and none of the above. Mainly the puffiness is actually fat. And it's not the kind of fat that you think about in other parts of the body because lots of people who don't have a lot of fat still get puffiness around the eyes. The eyeball actually floats in a layer of multiple tiny little fat pockets. And that type of fat doesn't respond to weight gain or weight loss like other areas of the body. So that's what causes most of the puffiness. There are also changes of the skin that can occur. When the skin thins, the blood vessels are noticeable, so that can be a little bit of blood. Oftentimes it's shadow. We very frequently have light coming from above. That's the most common situation that we have. And here's a perfect example of that. She has shadowing under the eyes. After surgery, the shadows don't cast from the fat deposits on the skin, and therefore the darkness is not there. Here's a quite dramatic gentleman who came to see me. Now, he didn't want to have any skin removed from the lower eyelids. He was happy just to take away the big fat deposits. So he still has some wrinkling under there, but you can see how he just looks well rested. The upper eyelids perhaps are the most dramatic change in this gentleman. Here's another really significant change addressing both the upper and lower eyelids. With extensive sun-damaged skin, it can be hard to get rid of all the wrinkles, but just to change some things around the eyes really makes a dramatic difference. Here's a woman who I think really demonstrates some of the most impressive changes that we can make around the eyes. Incredibly pleasant woman, but she did have some extra skin above the eyes, some puffiness and extra skin below the eyes. So in this case, I didn't do the approach without the incision. I actually made an incision under the eyelid, and you can see how that really just changed her whole complexion. And again, I didn't touch her lower face at all. I didn't touch her skin at all. This is just from the eyes. This addresses sort of all of those combined. So her eyebrows had come down. You can see how high she lifts her eyebrows. Her upper eyelids had some excess skin, and she also had a condition called ptosis, which is blepharoptosis, which is where the eyelid itself droops and covers the pupil. This is another thing you may have seen in some people where the actual eyelid has come down. They walk around looking like they can't open their eyes. And then she had a lot of extra skin and wrinkling below the eyes. Afterwards, you can see what a dramatic change that is. She could see much better. She could open her eyes and her brows much easier, and really just appears like a happier person and much better rested person. So before I move on from sort of the face, are there any other questions about some of these changes for aging-related techniques? Excellent question. So when we talk about forehead wrinkling, and I'll bring up hers as an example, in some people who do not have a low eyebrow, Botox is a great treatment. It's not permanent, but it's a great way to soften eyebrow wrinkles just with a quick in-office treatment.